Osteoarthritis. The truth, the hope, and the future of joint health. 1. Powerful motivational introduction. My dear friends, osteoarthritis is not just a disease of the joints. It is a disease that affects mobility, confidence, independence, sleep, peace of mind, and ultimately, the quality of life. Many people suffering from osteoarthritis feel pain while walking, stiffness after sitting, difficulty climbing stairs, difficulty squatting, creaking knees, swelling, fear of falling, disappointment with medications, emotional frustration. And yet, here is a truth very few people know. Almost every adult over the age of 35-40 has some degree of osteoarthritic change, but only some end up in severe pain. Why? Because osteoarthritis is not simply a wear and tear problem. It is a biomechanical, inflammatory, metabolic, muscular, circulatory, and lifestyle-related condition. And every one of these can be improved. Today, an era of new hope has arrived. Modern science, movement science, lifestyle medicine, mitochondrial science, and advanced therapies like EMTT have shown that pain can reduce, mobility can return, inflammation can calm down, and in early stages, degeneration can slow dramatically. Let us understand the truth, the hope, and the future. 2. What is osteoarthritis? Osteoarthritis, OA, is the most common joint disorder in the world. It happens when cartilage becomes thinner, synovial fluid becomes less effective, bones rub against each other, inflammation increases, muscles tighten, nerves become sensitive. It affects knees, hips, spine, shoulders, fingers. It's not simply wear and tear. It is a slow inflammatory and degenerative process influenced by lifestyle. Third, causes osteoarthritis develops due to multiple factors. Age-related cartilage dehydration, obesity, biggest modifiable factor, sedentary lifestyle, previous injuries, weak thigh and glute muscles, hormonal changes, menopause, chronic low-grade inflammation, genetics, excessive mechanical stress, poor posture, stress-induced muscle tension, poor circulation, nutrient deficiencies. It is a combination problem and therefore requires a combination solution. 4. Epidemiology. Most adults over 40 have radiological OA changes. Nearly 25% have symptomatic OA. OA is more common in women post-menopause. Knee OA is especially high in Asian populations due to cultural squatting, rising dramatically due to sedentary habits and obesity. 5. What age has to do with it? Age does not cause osteoarthritis. It only makes the joints more vulnerable. Many 75-year-olds have no knee pain, and many 35-year-olds have severe osteoarthritis. Age is a factor, but inflammation, muscle strength, weight, circulation, and lifestyle decide outcome. 6. Pathology. What happens inside the joint? Inside the knee. Cartilage dries and thins. Synovial fluid thickens. Joint space narrows. Bone spurs form. Osteophytes. Low-grade inflammation increases. Muscles around joint tighten. Movement becomes painful. Pain-sensing nerves become hypersensitive. This happens slowly over years, giving us time to intervene. 7. Traditional medical treatment. Painkillers, NSAIDs, steroid injections, gel injections, physiotherapy, hot-cold therapy, weight loss, bracing. These help symptoms, but do not reverse the underlying process. 8. Joint replacement. When and why? Knee replacement can help. Severe OA. Bone-on-bone condition. Extreme pain. Poor mobility. Failed conservative therapy. But not all need it. 10–20% continue to have pain. Recovery takes months. Risk of infection and stiffness. Revision surgery may be needed. Joint replacement is important, but it should be the last choice, not the first. 9. Recent advances in non-surgical OA care, PRP, orthobiologics. microbiome modulation, targeted physiotherapy, weight reduction protocols, low-level laser therapy, PEMF, neuromodulation, mitochondrial support protocols. And now one of the most promising therapies. Yashtian 10, EMTT. A breakthrough in osteoarthritis management, fully integrated section, complete explanation, no shortcuts. One of the most exciting innovations in the management of osteoarthritis is EMTT. Extracorporeal magnetotransduction therapy, a highly advanced magnetic field therapy developed in Europe. EMTT delivers high-energy magnetic pulses capable of penetrating 15 to 18 centimeters deep into tissues, far beyond the reach of conventional physiotherapy machines. Why EMTT is different. Most treatments work on the surface. EMTT works deep inside the joint, influencing cartilage tissues, synovial membrane, ligaments, joint capsule, surrounding muscles, subchondral bone, microcirculation, mitochondrial function. This makes EMTT incredibly valuable for early and moderate osteoarthritis. Rapid pain reduction, sometimes in one 20-minute session, many patients experience. Reduced knee pain, easier walking, less creaking, less stiffness, lightness in movement, better sleep in just the first session. This rapid effect occurs because EMTT reduces inflammatory cytokines, improves synovial fluid mobility, relaxes overtight muscles, calms hypersensitive pain nerves, increases local circulation, improves tissue oxygenation, enhances ATP production, cellular energy. How EMTT supports joint healing, scientific explanation, improves microcirculation. Joint tissues have poor blood supply. EMTT increases perfusion, Aero improves repair, reduces synovitis. Lower inflammation equals less pain, enhances cartilage cell activity, chondrocytes respond positively to magnetic stimulation, improves mitochondrial energy. More ATP equals better tissue maintenance, loosens tight quadriceps and hamstrings. Reduced muscular tension equals reduced joint load, improves joint biomechanics. Better alignment, reduced friction. Helps early OA stabilize by reducing inflammation and improving biomechanics. Does EMTT reverse osteoarthritis? No therapy can magically rebuild cartilage overnight. But in early and moderate OA, EMTT can. Slow the progression. Improve joint environment. Reduce inflammation. Improve lubrication. Enhance mobility, restore better function, significantly reduce pain, reduce severity, allow cartilage better chance to maintain itself, prevent further deterioration. In many patients, improvements are so strong that it feels like reversal. Avoiding joint replacement. The real hope. Most knee replacements happen not because the joint is totally destroyed, but because inflammation was ignored. Muscles became weak, mobility reduced, pain became chronic, lifestyle worsened the condition. When patients come early, EMTT combined with exercises, weight control, anti-inflammatory diet, physiotherapy, mitochondrial optimization, neuroregulation can delay and in many cases avoid joint replacement. This is one of the greatest advantages of early intervention. 11. Diet for OA anti-inflammatory foods. Turmeric, ginger, berries. Nuts and seeds, green vegetables, olive oil, fatty fish. Avoid sugar, white flour, processed foods, deep-fried foods. Hydration is essential. Cartilage depends on water. 12. Supplements. Vitamin D, 3 plus K2. Omega-3, curcumin, MSM, collagen, boswellia, magnesium, B-complex, glucosamine/chondroitin, mild support, CoQ10, mitochondria, 13, exercises, quadriceps strengthening, glute strengthening, hamstring stretching, hip mobility drills, cycling, swimming, tai chi, yoga, weight reduction walking program. Movement is medicine. Your joints are not finished. They are waiting for the right support. My dear friends, Osteoarthritis may slow you down, but it does not have to define your future. Your joints can improve, your pain can reduce, your mobility can return, your strength can grow again. And when you come early, when inflammation is still young, when cartilage is still alive, when muscles can still be trained, when the knee can still respond, the possibility of true recovery becomes real. Modern science has given us tools our grandparents never had, with disciplined exercises, anti-inflammatory diet, correct movement, weight management, mitochondrial support, and modern technologies like EMTT, which can give relief even in a single session. Your joints can heal more than you ever imagined. Your future is not pain. Your future is not stiffness. Your future is not dependence. Your future is not surgery by default. Your future is movement, strength, freedom, confidence, independence, and hope. This is the truth. This is the direction of modern healthcare. And this is the future of joint medicine. Healing is possible, improvement is possible, recovery is possible, and your future is brighter than your past. Thank you. Founder, Holistic Wellness Foundation, IMFAL Healing Beyond Boundaries.